Hi, my name is Laura Nicole Castro, and my topic is the impact of chemotherapy on the neuromuscular components of gait. The first definition, chemotherapy is the use of drugs to destroy cancer cells. It works by preventing cancer cells from growing and dividing into more cells. Because cancer cell usually grows and divides faster than normal cells, and chemotherapy has a greater effect on cancer cells. However, the drugs used for chemotherapy are strong and can damage healthy cells anyway. There is a video.
I'm Dr. Susan Love, and I'm Chief Visionary Officer of the Dr. Susan Love Research Foundation. Our mission is a future without breast cancer, and we do that through innovative research into the cause and prevention of the disease. Inpatient Science is a series of videos that we've made to help you understand your diagnosis and the treatment choices that you have.
As we improve outcomes for many breast cancer patients, more research is being done into the short and long-term side effects of treatment, the collateral damage. It is well known that cancer treatments can cause temporary side effects. With surgery comes postoperative pain, and with radiation, your skin can turn red. Chemotherapy causes hair loss, nausea, fatigue, and mouth sores, while hormone therapy can bring hot flashes or joint pain.
Nobody may have told you that there can be permanent, long-term changes to your body as a consequence of treatment. It's like fixing your car after a crash. It may run fine, but the passenger door will never close the same way as it did before the accident.
Collateral damage can take many forms. It can appear as lymphedema, which is pain and swelling in an arm or hand, or as peripheral neuropathy, a type of nerve damage that causes pain and numbness in the hands or feet. You might also experience chemobrain, a term often used to describe changes in memory and thinking.
A lot of times, these problems are overlooked and they aren't talked about that much. As a patient, you feel lucky to be alive, but it would be even better to have your brain fully functional and your feet not hurting.
Other collateral damage can include depression, anxiety, fatigue, sexual problems, and permanent loss of sensation in your reconstructed breast.
Because this damage is often underreported in metastatic patients, we started our Metastatic Breast Cancer Collateral Damage Project. In it, we asked people living with metastatic disease to tell us what they were experiencing in their own words. We've learned from hundreds of responses that there are many problems that remain unaddressed.
Some of the Foundation's recommendations are to raise awareness of palliative care, improve access to clinical trials, and provide resources for financial assistance, fertility, and sexuality support, amongst others. You can learn more about our Metastatic Breast Cancer Collateral Damage Project and participate if eligible on our website.
Our mission at the Dr. Susan Love Research Foundation is a future without breast cancer, and we do this through innovative research into the cause and prevention of the disease. You can join us at drsusanloveresearch.org to participate in our research or to help fund our research, because together, and it's going to take all of us, we can be the generation that ends breast cancer.
Second, application in physical therapy. The purpose of physiotherapy is the study of human body movement and its maintenance, recovery, and habilitation in any of its alterations, in order to achieve its integral rehabilitation and contribute to a better quality of life in human interaction with the environment.
There's days that I can't get out of bed because my body just hurts so bad and you're on so many, not only chemo medication, but you're on different home medications.
I'm Laura Bleck, and I've been a physical therapist in the Valley since 1998. And at that time, my former employer had a bunch of us therapists lymphedema certified.
Originally, I started coming because I had a small case of lymphedema, so I thought that's all that I was going to be working on was my right arm, and that was it. But we've been working on strengthening, getting my, heart rate up for cardio, and it's helping me just try to get my strength and energy back. Instead of having to lay in bed all day long, now I can get out and do something. And I snowblowed the last 2 days, and there's probably no way I would have been able to do that if I didn't have the program.
So when the Fox Valley Hematology and Oncology group decided to come this way, we asked if we could be part of their rehab services to offer truly a full, comprehensive care for their patients.
I've gone through different physical therapy before for all sorts of different things like neck injuries, wrist injuries, and she just has that really good personality, kind of like I've been able to kind of open up to her and talk about our families and stuff like that. Just kind of made it feel warm and welcome, like a place that you actually want to come to instead of like, oh, this is another appointment I got to sit through for like an hour.
Over the years, working with the cancer population has just, it's been such a rewarding experience that we wanted to do something more for the Valley and truly meet all of their needs. There's studies that show, 65 to 85% of cancer patients will have some sort of functional impairment following their cancer treatment. And as cancer gets looked at more as a chronic disease, it's definitely important that we get these patients in so they can return to their normal jobs, or if they're mothers that have young children at home, that they can be as active with those kids as possible. And so we definitely can help more than just the patient who has that chronic swelling. We can help patients just get back to their normal quality of life.
Third, pros and cons. One of them, improve physical strength. This can compensate for limitations caused by cancer and cancer treatment. Achieve good posture and optimal functions. Improve exercise tolerance and manifest fatigue. Cons, one of them, anemia, fertility problems, anxiety, depression, and sleep disturbance. There's a video.
I didn't know how weak I was.
Trey Gunn runs a small plumbing business working on pool installations in North Texas. But his ability to do his job was compromised following successful cancer treatment.
It was about a year ago. I was diagnosed with head and neck cancer. I had my left tonsil, and I had a big knot. After chemotherapy and radiation, I still didn't really feel that great. The smallest things, I remember I was cooking, and I picked up the pan to just pour the pour, and I didn't have the wrist strength or something, and it was, what happened? And then I came here.
A lot of times the patients come in very skeptical. How in the world is physical therapy going to help for the treatment I had for my head and neck cancer? But once we start to go through our assessments with our patients and really spend the time to educate them on not only what we are going to be doing, but how their condition has affected their body, there's really not too much convincing after that, because it gives them the why to explain how they're feeling. One of the things with our oncology patients is a lot of their treatments actually affect their body systemically. So, for example, somebody can have cancer in their neck or in their throat, and they're experiencing numbness and tingling in their hands or their feet, which is a side effect from some of the drugs that they have to take for their chemotherapy regimen. So we really want to look at the entire body and not just focus on the area that was treated, so that we can see exactly what is the cause of the impairment and what we can do then to help treat that and get them better.
In Trey's case, he had involvement in the neck and radiation to the neck, so therefore he had swelling in his neck. And to treat that, we did something called manual lymph drainage, where I use my hands to move the fluid. And I also taught him how to do that on himself. And then we also used compression with a foam pad, and he wore that at night. He had an injury to his ulnar nerve, which affected 2 fingers in his left hand. We're not sure exactly how that happened, but he was having trouble moving those fingers well, having trouble gripping. He's a plumber, so he's having trouble working with his tools. And so with some strengthening and different things, we were able to get his hand function better.
After just a short period of time, I started to feel better. I wasn't as dizzy, and just all my side effects started going away. It was very amazing.
Know what your side effects are. Don't be afraid to ask your doctors. Don't be afraid to tell your doctors about things that you're experiencing.
These people can help you stay active. They'll help you progress and get you moving and getting back to regular life again. But you just got to keep moving.
For use of gait in the quarter. Oncologic pain is sensory, subjective, and unpleasant manifestation that may be due to a real or potential injury. Derived from cancer and or its treatment, its optimal management is complex, requiring a multidimensional approach. Pain is a frequent problem in these patients with a prevalence of 80 and 90% in advanced stage. At the time of oncology diagnosis, patients may present pain from 20 to 50%. Finally, the conclusion is with a well-planned physiotherapy treatment adapted to each patient can help to reduce dizziness and pain, improve lung capacity, reduce the side effects of the intervention, prevent new recurrence, and reduce both morbidity and mortality. Thank you.